In this section, we will train you on the proper use of the HoverMatt air transfer system in an emergency department. We will explain HoverTech's recommended protocol for proper HoverMatt placement on an ED stretcher, receiving trauma patients, and performing portable X-rays. This segment will show the HoverMatt in use. Please review Using the HoverMatt Air Transfer System and HoverTech Air Supply video for detailed instructions before using the HoverMatt Air Transfer System. The emergency department, as a major patient entry point to the hospital, will often be the first area in the hospital where HoverMatt use is initiated. ED stretchers should be equipped with HoverMatts in anticipation of the emergency patient's arrival. Whatever linens are placed on the bed mattress to keep it clean can be placed on top of the HoverMatt to keep it clean. Tuck the top linen in under the stretcher mattress. Ensure that the patient's safety straps are out of the way, yet still visible. Disinfect the HoverMatt transfer mattress and air supply between patient uses with whatever the facility uses for medical equipment disinfection. The transfer mattress can also be laundered. Refer to the HoverMatt User's Manual for detailed instructions before laundering the HoverMatt. The air supply should be hung off to one side at the end of the stretcher for immediate availability. When a patient presents to the ED, arriving by ambulance or otherwise, he or she should be transferred directly onto an ED stretcher that is equipped with a HoverMatt. Patients on backboards can go directly onto a HoverMatt-equipped stretcher. Ambulance stretchers may already be set with the reusable or single patient use HoverMatts. If this is the case, use the HoverMatt to transfer the patient from the ambulance stretcher to the ED stretcher. In this segment, there are no linens on the stretcher pad for demonstration purposes only. Linens should always be applied on top of the HoverMatt for patient use. Lower the receiving surface or raise the sending surface 1 to 3 inches for an easier lateral transfer. Use the HoverTech Stay Close approach to transfer the patient's inflated HoverMatt transfer mattress at an angle, feet first, onto the receiving surface. Remember to always inform your patient and assume the position of safety before inflating and deflating the HoverMatt. Ensure the patient's body is centered on the receiving surface prior to deflating the HoverMatt. Because the HoverMatt is radiolucent and artifact-free, it can be used to make the positioning of a portable X-ray cassette under a patient easier for the caregiver and more comfortable for the patient. If using a metal-rimmed cassette, cover it with a pillowcase to avoid tearing the HoverMatt during cassette placement. Inflate the HoverMatt. While a caregiver remains close to the patient for safety, the X-ray technician performing the X-ray should inform the patient of the task and then insert the cassette under the inflated HoverMatt at the desired location. Deflate the HoverMatt when the cassette is in position. The HoverMatt must be deflated for the X-ray procedure and patient safety straps unbuckled and moved away from the X-ray site. Once you have taken the X-ray, assume the position of safety. Reinflate the HoverMatt and remove the cassette. Turn off the airflow of the air supply by pressing the standby button. The emergency patient can also be transported directly to imaging on the HoverMatt. Please view Using the HoverMatt Air Transfer System in Radiology for more information. In this section, we explained how to use the HoverMatt Air Transfer System in the emergency department. Here are the key points from this section. Because it is a main patient entry point, the emergency department is often the first department where HoverMatt use begins. HoverMatt transfer mattresses and air supplies should be placed on ED beds in anticipation of the incoming patient. The HoverMatt transfer mattress is radiolucent and artifact-free and can be used to make positioning X-ray cassettes easier for the X-ray technician and the patient. In this section, we referenced the correct procedure for inflating the HoverMatt transfer mattress and a HoverMatt transfer using the Stay Close approach. Both techniques are explained in detail in the Using the HoverMatt Air Transfer System and HoverTech Air Supply video.